Hi, it has been 3 months since you finished TMS and you've come back for a 3 month follow up. And I wanted to ask you what you've learned and how you're doing.
Yeah, so after 3 months, so first of all, I was off Adderall. I wanted to find an alternative method of managing ADHD and severe, anxiety and depression. Once I got off the Adderall, I was up to about 30 milligrams of extended release.
So when you came to us, you were taking 30 milligrams Adderall extended.
Yes.
And how was that for you taking that?
Yeah, well, I was on it for 6 years, all
Wow.
my professional life. So it was a high dosage, and that's all I kind of knew myself professionally, is just being on Adderall and go. And every time I would try to step back from it, hit severe lows and felt super depressed and anxious. Like, how do I work? How do I cope every day with a job without being on Adderall? So eventually I got heart palpitations and some issues, and it was just too much. So I decided to stop cold turkey and was searching for other ways to, help manage my ADHD after 6 years on 30 milligrams. And that's when I started the TMS. So I was off the Adderall by the time I started. Went through my treatment, and then I remained off for a good month or so, but then those symptoms started slowly coming back. And I couldn't do nearly the same dosage as before. I didn't feel like I needed.
So now you're talking about being off, being done with TMS.
Yes.
And you felt good, and then you felt like, wait a minute, I need some help focusing.
Yes.
So then what happened?
So then at that point, I still felt good after the treatment, but I just needed a little extra help concentrating and with that ADHD. So I tried with my provider Adderall, but the lowest, 10 milligrams or so. And I reacted very poorly, considering it was on 30 milligram extended release. I couldn't sleep at night. I was feeling all the symptoms just so much stronger, which I thought was really interesting. The negative side effects of that low dosage.
Yeah.
So I stopped it, took a break, and then went to Vyvanse, which is a lot more consistent. It's not as aggressive as the Adderall. And I've been on that for a month, and we found it's the perfect dose, is the lowest dose.
So you're taking 10 milligrams.
Yes.
And you were taking 30 before TMS, and now you're 10, and you're feeling good.
Yes.
You're getting what you need.
Yes, I feel good. That's exactly what I need. No other issues. No need to go up in dosage, actually, which I'm really impressed with. I feel a lot more just stable and level-headed, I think. Especially I'm moving in the next couple weeks, which normally would make me super anxious, but even on the Adderall, I would be all over the place. But I feel really calm and collected and confident, I guess, my abilities to handle stress.
Wonderful. So net effect, to sum that up, what would you say? Sum that up for me.
I would say, whatever your reason may be, just listen to your body before, during, and after, and just stay patient and really focus on what helps you feel good day to day and help manage with your daily life. It's okay to kind of make those adjustments as needed, but after this is the 3-month follow-up, 3 or 4 months. So
after TMS,
so it's good to kind of just stay patient.
Mm-hmm.
And then make adjustments if needed. But overall, I'm still happy with my treatment.
And are you happy that before TMS you were at 30 milligrams and not feeling great? You got off, you did TMS, you got a nice result. Then you decided, I'm going to try a little more stimulant, and now you're getting a great effect at 10 milligrams.
Yes, that's exactly what I wanted. I wish I didn't have to be on the stimulant at all, but like I said, you have to be adaptable and do what's best for your body. So I'm really happy that I can do the best of both worlds. I got my TMS, and now I got the lowest dosage of the stimulant.
Do you feel then that TMS helped you be able to take less stimulant and just feel good overall?
Yes, 100%.
Well, that's nice.
Mm-hmm.
That's nice to hear.
Yeah.
And the TMS itself, what do you think the TMS did for you, other than helping you lower your Adderall dosage? I'm sorry, get away from Adderall and then do a lower Vyvanse dose.
Yeah, I think there's something about with managing my emotions and anxiety and stress that really helped me stay just level-headed throughout the whole treatment and afterwards. I would say as far as those low days with depressional bouts, as I call them, whatever the reason may be, didn't feel as nearly as aggressive as what they used to be pre-TMS. So it really helped alleviate a lot of those hard symptoms, which I didn't think was possible without taking a medication, which I didn't want to do.
So you're more even. Your mood
Yes.
is more even.
Yeah, I'm more even. I feel a lot more in control, but without being numbed. Like other medications like Wellbutrin or whatnot just kind of shuts everything off. So I can still be myself, but just have more control over, the highs and the lows.
Nice. So overall, you also feel more resilient. It sounds like with this move, you're really able to handle it.
Yeah, I think pre-TMS, this would have me freaking out. I'm moving alone across the state and, tight budget, and it takes a lot of planning, but I feel good. I feel confident in my abilities to do it. And I really think TMS, the timing worked out perfectly. And that's why I'm able to feel good about this move.
And do you think that the TMS gave you the confidence to do this versus stay in your same?
Yes, 100%. I really think where I was at with the Adderall dosage and kind of how I was functioning in my life, just high level anxiety all the time, and really mentally just all over the place, easily stressed, easily triggered, anxious. I really think the TMS has helped stabilize that.
Wonderful. Mm-hmm. So you're glad you did it?
Yes.
We're glad to see you on less stimulant.
Yes. Take less stimulants.
And to see the resilience and the confidence, and that it has kind of facilitated you putting this move into effect, which is something I think you had thought about, but then you were able to do it.
Yeah, I'm actually able to do it, and I can step it up in my career and feel confident and get ready for that next promotion. So
love it.
Without Adderall.
That's pretty good. And how good does it feel to not be dependent on 30 milligrams?
It feels amazing. Just not constantly wondering when I'm going to get that next dosage, because there's always a shortage of Adderall and just stimulants. And so it's nice to, if I'm feeling down, just eat better or go outside for a walk. You're not totally focused on a pill. So long term, I'd like to get off the Vyvanse completely and go to therapy and help manage my ADHD better and not be so dependent on a pill.
Well, and that's a possibility. We're just happy for you. I mean, you just gave me a depression score of 1, which is really no depression. 6 or under.
Yeah, that's genuine. I mean, I've got a lot of stuff happening at work. I'm getting ready to move, and I honestly feel great. My family and friends have noticed a difference as well, which is really empowering.
What have they said to you?
Well, they've asked me what I'm taking, and I said nothing. I'm going out doing my hobbies, and
what do you take?
That's what I said. I'm like, we don't have to take something every day to feel better, but they just, again, with that level-headedness, just even, not being numbed per se, but not being overly excited like I used to be on Adderall, just very level-headed, mature. I mean, I'm 28, I'm not maturing anymore, but just something about developmentally, I've grown a lot, I think, in the last year.
Wow. Well, that is great. We are so happy for you. Thank you for taking the time to talk to us.
Yeah, always.
All right. Good luck.
Thank you.
Bye-bye.